Just press the button.
I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And this is my client, Sarah, and she presents with a restriction of traction in the upper cervical spine. And I'm implicating the C1, C2 joints, not the occipito-atlantal joint. When I'm in front of the mastoid, I can spring on each side, just ever so slightly. There's rotational mobility. And I can also come beneath the mastoid and spring sideways. And for that reason, I don't believe that there's a restriction at the OA joint. Now when I come right beneath the mastoid onto the lateral part of the transverse process of C1, and then I try and induce a left side glide and a right side glide, that motion is restricted. So right now I'm trying to move and there's just no give there. And I'm trying to push it to the right with a reasonable amount of force and there's no give. Now if I come down to C2, transverse process, boom. You know, it's very, very easy to induce motion. Now the other thing I can do is put her head in slight flexion to expose the spinous process of C1. And now I'm trying to lift it anteriorly, and that's restricted. If I come underneath to that prominent C2 spinous process, you can see it's really easy for me to induce anterior glide. The other thing that causes me to believe that it is stuck in extension is that in neutral, I can induce traction mobility, and I can even see her feet bob up and down. So the force translates inferiorly throughout the body. If I put her in slight flexion, about 10 degrees, maybe 15, she also has that free and easy mobility. Now she did comment when I did this traction a while ago in neutral, she commented that that felt good. And that was spontaneous. Now when I put her in extension, now she doesn't move. There's no free and easy traction mobility. And it's important to point out that the contact must be in front of the ear, because the upper two joints are right beneath the ear or right beneath the mastoid, whereas the rest of the cervical facets are back here. Okay? And I made the comment that I stated that she was stuck in hyperextension, and I can't do any traction. So she must be at end range, given that in an extended position I cannot induce any traction there. So we look for mobility in traction with the contact on the anterior part of the face and head. And we test it in extension, and we test it in neutral, and we test it in flexion. And the rules are that if it's restricted in extension, then the treatment is done in a direction where you have a little bit of freedom. So I'm just putting her in 5 degrees of flexion, and I can get a little bit of distraction there, all the way down to the feet. And but because so in this position, I'm going to treat it, and I'm going to do this for 5 minutes. So I'll stop filming, and we'll come back and we'll film the response to treatment. Thanks.